Hello and welcome to the Heal Yourself Now Summit. I'm your host, Lindsay Fitzgibbons, and I'm excited today to introduce Dr. Arielle Foster as our guest. First, I just want to say, this summit is really created to help those of us out there suffering with chronic conditions. It was inspired by the Rumi quote, "The wound is the place where the light shines in." And I hope that this summit and this interview today is a source of light and hope and support and healing for you. So Arielle Foster is a doctor of physical therapy, a yoga teacher since 2001, an anatomy teacher for yoga teacher trainings, and founder of Yoga Anatomy Academy. She has a passion for creative, intelligent yoga instruction and for making yoga anatomy accessible. Arielle's physical therapy practice is founded upon treating the whole person. Dr. Foster uses hands-on manual therapy techniques along with precise targeted strength training and neuromuscular reintegration to achieve optimal recovery for patients. Her interdisciplinary teaching is grounded in both a compassionate approach of Kripalu Yoga and her deep understanding of musculoskeletal well-being from working with thousands of patients. Arielle has completed yoga trainings in Kripalu, Anusara, Therapeutic, Hatha Yoga, and the tradition of Madi Urzarati at YogaWorks, and is an ambassador for Kira Grace Clothing. Arielle, welcome. Thank you so much for being here.
Thanks for having me, Lindsay.
I was hoping to just start with you sharing some of your story of how you got into yoga and physical therapy and the healing arts. Whatever you feel comfortable with about how your path took you to where you are now.
Sure. Yeah, so unlike a lot of people in my generation, I had a significant amount of exposure to yoga growing up. So I had a grandmother, she's still around, who taught yoga. I had two teachers that I was very close to in my high school years who also were teaching yoga. I got to take a yoga class as part of my PE credit in high school. And then I remember in college taking a couple of classes that just really, really blew me away. And around the end of my time in college, I started teaching yoga myself. I had gone through, a yoga teacher had suggested that I take this training, which I did, and then I started teaching. I was 22 years old, and I loved it. I loved teaching yoga. I was teaching it like nights and weekends, working full-time jobs in environmental policy in Washington, D.C., and after about 4 years, I ended up hurting my shoulder pretty badly, and it was a yoga injury. Which is not to say that it was 100% because of the yoga. I think that maybe I just pushed myself too hard in yoga, and my body wasn't ready. But I also think that there were some cues from yoga that were just really, really unhelpful and probably contributed. In my great desire to be a good student, I focused so much on the alignment, and I ended up hurting myself. So when I got injured from yoga, I saw a physical therapist, and it was the first time in my life where I thought about doing anything other than environmental advocacy. And I realized that I wanted to be a physical therapist. So that took me on a really long journey, but I got my doctorate in physical therapy, and I'm still teaching yoga. Now I see patients, and I also teach anatomy for yoga teachers.
Great. So I find that yoga sort of sits in this really cool place in the middle between the physical. Obviously, there's a big part of yoga that's the physical practice. Then there's also sort of the mental, emotional, and spiritual practice side of yoga. And you also have this great physical therapy training, so you really understand the body and the mechanics of it. So I would love to hear you talk about the way that you work with imbalances in people. So you're probably seeing people come in with physical imbalances for a variety of reasons, but I'm curious about how the underlying spiritual and emotional and mental side of that imbalance shows up and how you work with it. as you're working with the physical?
So one of the things that I think, looking from the outside in, you might think that there's just so much overlap between physical therapy and yoga, or being a teacher of yoga and being a practicing physical therapist. And I think in a lot of ways they're very, very distinct. Certainly the education you get as a physical therapist is very, very different than the education you get as a yoga teacher. So what I can absolutely speak to is the ways in which my background in yoga informs what I do as a physical therapist, and why that I think makes me a better physical therapist because of it. So one of the things you realize very quickly moving into conventional medicine, or relatively traditional medical field, is that that many patients have been through the system. They've been to see lots of different doctors, or they haven't really been heard by different doctors. And so our first primary role as a physical therapist, and I think most physical therapists, whether they have a yoga background or not, would agree to this, at least in theory, is to truly, truly listen to the patient, to ask questions that are targeted right in the beginning so that you really get a sense of what's going on. And then when you're listening to the patient, you can also figure out whether it's purely a physical thing or whether there might be other layers going on to it. Now, I don't really think that anything is ever purely 100% physical, but it's also not exactly like pain is just in your head and therefore you have to suck it up and deal. So it's somewhere in that middle ground for almost everybody. Let's call it a spectrum. And so if you just have a slip on ice and you break your ankle and you get in to see a physical therapist really quickly, then you can get back to moving very, very quickly. But some of the stuff that might come up along that journey would be fear of movement, which is known as kinesiophobia, just a fear of falling again, a fear of pain, sort of maybe not having pain when you're resting, but having pain when you stand. All sorts of things can come up. And so if you really want to be a skillful medical provider on any level, that listening and paying attention is so key. So really paying attention to what the patient values the most, what is giving them frustration or anxiety in any given moment, because an injury is never just about that physical body part. Like I said, it could be about fear of falling, fear of aging, fear of ending up the way, your parents or your grandparents ended up. And even for young people, athletes have a fear of not being able to get back into the game. And it can be really pervasive, and it affects your healing process.
Yeah, that makes a lot of sense. I mean, the reactions that we have to the loss of, function in a particular part of our body would understandably bring a lot of emotions forward. So what kind of patients do you tend to work with? Do you have sort of a niche that you work with?
Yeah, let me back up just a little bit. So just to summarize what I was saying a moment ago is that I think that my background as a yoga teacher of 16 years now, has given me a bit of an advantage in really in that listening process, in really treating the whole human being that's in front of me, looking at the way they move, et cetera. And that's what I really mean to convey, and that the way that yoga has helped my physical therapy practice is that I can't extract just the biomechanics and be like, okay, you're off and done. So now remind me of your question again.
That was a helpful summary. I was asking about what type of patient or client do you tend to work with? Are there certain injuries that you see, or body parts, or who tends to come to your door for help?
Yeah, well, I've been really lucky in that I've been working for most of my entire physical therapy career in different teaching hospitals. So most recently at Georgetown University Hospital in Washington, D.C. And I just get this huge spectrum of human beings coming in the door, people who are being pushed in a wheelchair, anywhere from 5 years old to 95 years old. I don't think I've had anyone older than that. And, men, women, all kinds of body part issues. But I do tend to see a lot more private clients now, a lot more private patients as well. And that's becoming a bigger part of my life. So I often see yoga teachers. I often see people who are really dedicated to their yoga practice. These are the folks who seek me out. And then I often see, and I like to treat hip and I like to treat neck. I find that hip injuries are more common than we think they are. And they're relatively common in yoga, which is not to say that they don't exist in other physical activities, but they're relatively common in yoga. Shoulder as well. And then neck stuff, I think, is just universal. And when you have neck pain, it can just affect your whole body in a negative way. There's something about neck pain I find that just can be so pervasive in the way that it adjusts your life, it affects your life. So those are the kinds of patients I tend to see. But I do any kind of orthopedic physical therapy. I don't do neurophysical therapy, so I wouldn't be a specialist in Parkinson's disease or stroke. Although I've treated plenty of these patients, it's just not a specialty. I see orthopedic conditions, so everything from ankle sprains and bunions up to neck disc herniations.
Okay. So you talked a little bit about how you start to work with people. So listening is like the foundational level of working with a patient. What are the other ways that you work with patients, particularly when they've got some understandable emotional reactions coming up, like fear of movement, when the fears really arise? How are you able to work with people? What techniques you use? What tends to tends to help?
Well, I think that to some extent folks come to see me thinking that I'm going to assign a bunch of yoga poses, and I rarely do that. If you're practicing yoga and you enjoy practicing yoga and you come to see me, you're probably already doing yoga poses. Now, what I do is I might look at someone's yoga practice, the physical asana practice, and offer tips and alignment cues and things that might be unique to their body. But I don't tend to use yoga asana precisely as a tool. I tend to use a lot of the breathing techniques, specifically one breathing technique, so diaphragmatic breathing, and I tend to use a lot of myofascial release techniques, so sometimes using my hands, but more often than not after the first couple of sessions, teaching patients to do their own myofascial release and to move in ways that are going to be much better for them in the long run. So myofascial release is kind of what it sounds like. It's like deep. It can be deep tissue massage. It can be a form of deep tissue massage, but it is also something that you can do to yourself. You can lay on a tennis ball. You can roll around on a foam roller. You can even use your own hand or a pizza roller or pie roller, that kind of thing. Anything to help to maybe get the tissue itself moving a little better and hydrated a little better. What I find is that for folks who have chronic pain, myofascial release and really learning the empowering aspects of self-myofascial release is essential to kind of getting over your hump. And so it's something called motion is lotion. So I'll come back to that in a moment. But I thought I'd just tell this one story of a patient that I saw a couple days ago. She came in, she had a surgery 9 months ago on her ankle, and she works as a tech in the hospital. So she's on her feet all the time, and maybe she might even have some extended days, like 10-hour days. So she comes in, and this is about her 15th physical therapy visit back and forth between me and a different therapist. And she has been doing really well at the end of all the sessions. She was doing really well for a while, but she spaced out her physical therapy appointments a lot, like over 6 months. And even in the beginning, she didn't get, the physical therapy at the time that she really needed it. So I see her, and I hadn't seen her in a couple months, and I was like, I was so confused why she was having so much pain, because we really got her on a good track. So I started talking to her about all the things that could be affecting her pain. So one, it could be the statins that she's on. Statins are a medicine that's really popularly prescribed to help with heart issues, but they are cholesterol, but they are really hard on the muscular system for a lot of folks. They're really hard on your muscles. And so a lot of people get chronic pain, maybe not a lot, but let's say easily over 1% of people are having bad reaction to statins and getting muscular pain from statins. So I was talking to her about that. I was talking to her about her diet, whether she's drinking soda. That's like, to me, if you're drinking soda, that's just a red flag that, you're not putting up the basic self-care boundaries. And she was definitely admitting to eating a lot of junk food and not getting regular exercise and not really regularly doing her physical therapy exercises. So she had to get back to work. She was in a rush. She was also anxious about all this personal stuff in her life. So it was like, clearly there's this big picture of things that I don't really get to help her with in her life. I can only talk to her about it and give her suggestions. But the things I could help her with were the exercises. I reminded her of all of her home exercises. And then I had her go up and down some stairs that we have in the clinic. So she goes up and down the stairs, and every stair hurts. And she goes, oh my God, that's like a 6 out of 10 pain. Okay. So I get her back to the table. I put a tennis ball under her calf on the same leg that she had the surgery on. And 30 seconds goes by because, like I said, she's anxious and she's ready to jump up and go. And she gets back on the stairs after only doing self-myofascial release, like without very good instruction, really. She was kind of just like going about it without really listening to the things I was saying, or rather good technique. She had a lot of instruction. She gets back up on the stair and her pain went down to 1 out of 10. And it was just that fast. It was that fast. And so I don't know what's going on in that scenario, whether it was really the myofascial release that worked, although I think it is, whether it was the fact that like there's some emotional connection to the fact that like she stood up and was empowered to do something and she did it and it made an immediate difference. Whether, again, like I said, it might be related to the statins that she's having this chronic pain. But it was so fascinating. We had a 30-minute session, 25 minutes, or this was all talk, like what is going on in your life? Why are you not doing the exercises? Why are you not coming to physical therapy more often? What do we need to do to change these things? What do we need to do to get your diet better? And then 30 seconds of treatment, she had an immediate effect. And I didn't even put my hands on her. And I'm a pretty hands-on physical therapist. So that I thought was just so illuminating to the two things that are really drivers for me as a physical therapist and as a medical provider. One, definitely empowering your patients to do more, talking them through all the qualities of their life, that holistic quality of their life, but also empowering them to just take some time every day to take care of themselves. So the self-empowerment, and that's different from putting your hands on people. I do put my hands on people. I do a lot of myofascial release where it's using my hands, but I don't do that as a primary factor of someone's treatment because they need to be able to be empowered to get better on their own as well. And a technique like putting your calf on a tennis ball, wiggling your toes around, spending hopefully more like 60 seconds on each calf, and then going about your day is so much easier to incorporate in your life than medical appointments. And then the second thing is just the self-empowerment track, and then the second is that self-empowerment subset of self-myofascial release. How powerful those two things are is just something that comes up again and again in my patient care.
That's such a great story. I love it on so many levels. Just sort of happy that woman found some relief from her pain because, as you know, I'm working with it all the time. The chronic pain is so, feels like it can just, like the layers can like pile up on top of it when you're constantly in pain. And that this really accessible technique of myofascial release is totally in the hands of your patients, and that you're teaching them to step into self-care in an easy, accessible way. Because I think that, you know, it can be really easy to put the power of healing ourselves into other people's hands, and that one opportunity of having a chronic condition is that you can learn how to, it's such an opportunity to take better care of yourself or ourselves. And that these different providers are really sources of information to help us, to help guide us, so that we can learn these amazing techniques that you offer your patients, and opportunities to talk through it. I mean, I think that's really an interesting example, that 25 minutes of your appointment with her as a physical therapist is really listening to her, and how powerful, and I'm sure how powerful and healing that was for her.
Admittedly, it was a combination of listening and just being like, girl, you got to get your act together, right? Like really kind of encouraging her to take some very proactive steps and pointing out things that I think a lot of doctors, they'll say things like, you got to lose weight, but it's got to be more specific than that, right? Like if somebody is being told you got to lose weight, where the heck do you start? And that's a whole other conversation. I'm not an expert on that, but maybe you just start with one thing. Maybe it's taking those 2 cubes of sugar that you put in your coffee and getting it down to 1, and then eventually getting it down to 0. And maybe that takes 6 months. Maybe it's cutting out all the brown soda and then getting just to the clear and the light soda and then cutting that out as well. And again, giving yourself permission to have some time on that, but making really firm, clear, step-by-step decisions to improve your overall well-being. It's really hard as a physical therapist to help you heal your tissue, because at the end of the day, that's what's going on. The mechanical level is healing of your tissue if you're not getting the proper nutrients to those tissues in the first place. And in this case, this particular patient was pre-diabetic, but there's also a good possibility that she was now actually diabetic, because again, this was showing up as leg pain, like on both sides, bilateral, up to her knees, really from her toes to her knees. And so that's also a sign that, you don't want to joke around with this pre-diabetes situation if that's going on. And so I don't know if anybody had sat down with her and said, like, really taking the time to be like, you can't be doing this anymore. So, not to harp on this one story, I think the issue of chronic pain is so much bigger than that, and it can happen to people who are in seemingly extraordinarily good health. I watched the Lady Gaga documentary recently. Have you seen that one?
I haven't. I've seen it, but not had a chance to watch it.
Oh, you heard about it? Yeah. So Lady Gaga is somebody who has a lot of pain, and it comes and goes, and she pushes through it. Now, she's somebody who can afford a tremendous team of folks who are treating her. So like massage therapists who come to her home, et cetera, acupuncturists, et cetera. But, watching that is really powerful. And I think that one of the things that can sometimes happen in our minds, and I've experienced this myself when I've been in pain, is this idea that I am no longer capable. Like, oh, there goes my dream of running a 5K because this knee hurts. Or there goes my dream of having more children because my back hurts. Or, really even on a more insidious level, just like not wanting to move as much as you formerly did. So not taking walks, not getting your steps in, not in the case of somebody who's a yoga aficionado, avoiding yoga classes. And I think that there's just a lot more potential to heal when we stop being afraid of our bodies. So one of the things that we know is that the human body, even though it's very vulnerable, there's been, I ride my bike as a commuter, for example, and so there's been a million times where I've been like literally just brushes with death through, whether it's car doors or tractor trailers, et cetera, going by. But, so the body's fragile on that level, that we could be seriously injured or die at any moment, not to be too dramatic, but that can happen. But it's also, on the other hand, it's extremely powerful and strong. And that people who have had strokes come back to walk again, people are surviving just really astounding levels of injury, and sometimes truly thriving afterwards, even after, a profound spinal cord injury. In fact, a friend of mine, I'll give a shout out to, his name is Sam Morris. He had a spinal cord injury when we were in college together, and he has gone on to develop a training called Zen Warrior training, I think. And he's just one of the most inspirational people I know. He doesn't have any excuses about his life and what he's capable of or not capable of. He is really the author of his own life. So that is super empowering. That's something that I want to convey as a physical therapist and as a yoga teacher to my students and to my patients. And part of that empowerment and part of that, I'm not sure if this is a word, but defragilizing the body, so not thinking of our body or our body parts as so fragile anymore, is something I call motion is lotion. So motion is lotion is just to say that most of us, even if you have chronic pain, that you will benefit from getting up and moving. Say you have chronic pain in your low back and it's a 3 out of 10 or 4 out of 10 all the time. But that discourages you from something like a daily walk. But if you haven't tried walking in a while, what I would encourage you to do, especially if you've tried physical therapy, if you've gone through different healing modalities, is to just take a walk. If you're already in 3 to 4 out of 10 pain, the worst that can happen is your pain gets to be higher than that. But on the flip side, it could stay the same. It's already a 3 or 4 out of 10. So, are you going to, can you take 20 minutes out of your day to go through what's initially going to be a very uncomfortable exercise, which is walking, get a little bit of more motion in your body, and start to defragilize that idea that every movement is going to hurt. In fact, arthritis is a chronic injury, not injury, but a chronic condition. You can't, as far as we know, biologically speaking, reverse the onset of arthritis, osteoarthritis, that is. So the arthritis that affects your cartilage. When you lose cartilage, your body doesn't go in and just like, oh, hey, we're going to make some more. Like, if you get a scar on your skin, your body's going to go in and heal it up. You're going to get some new skin. You don't really get new cartilage. So the one thing we know that is effective for staving off the symptoms of arthritis, which doesn't necessarily change the cartilage itself, but the symptoms will be changed by strengthening. So the more you can strengthen around that joint, if you've got knee arthritis, strengthening your glutes, strengthening your ankles, working on your balance, working on the muscles within your feet, they can be profoundly helpful biomechanically. And then motion is lotion is not only maintaining that strength, but it's also rewiring your brain to say, hey, I might have some level of pain, but so long as I feel as though I can move through it, so long as I feel that I can move and not have it spike, that I can still be healthy, that I can have more ownership over what my day looks like, what my life looks like, what my movement capacity is. And that is truly, truly profound.
Yeah, well, yes, and it feels like, I can see that for somebody who hasn't moved a lot, or if they are afraid of pain, that it would be a little bit of an obstacle or a hurdle to get over, but that that you're just like creating, it sounds like the way you're describing it is the lotion, I like the idea of the lotion or the light, like lighting that path forward of like rewiring your brain in a way that gives you more resiliency and capacity and a different understanding of your body. Because with certain types of injuries, it can be like this hyper focus of like you only see your body as this back injury or this knee pain, instead of like this broader conceptualization of like, I have this entire body and yes, there is this place, but like, let's also consider everything else and all of the benefits that we would get from movement or the release work that you do. it's a powerful way and sort of reframing, I think, of it for people who do have these different chronic conditions.
Yeah, I'm all about that. And I just want to say a couple more things on that. So this is just a shout out to anyone out there who is in chronic pain. There's often temptation to get imaging done, imaging meaning like MRIs or CT scans or X-rays. And I'll tell you that if you take an X-ray or an MRI of pretty much anyone's spine, anyone over the age of 25, you're going to see some degenerative processes. And you will probably see some disc herniations or at least disc bulges. And when you are someone who has been on the receiving end of a diagnosis, for example, like disc herniation, it can be life-changing in the way that you think of yourself and you think of your capacity. I have a friend who is a yoga student who suffered from a disc herniation, pretty bad one, about 12 years ago. And to this day will say, I can't do that because I have a herniated disc. And you know what's going on in my mind? Well, you're almost in your 50s. And if you had one disc herniation 12 years ago, probably right now you have more than one. But on the flip side, within that time frame, this person has now lost a ton of weight, gotten super duper strong, and become and is just so committed to his health, like in terms of the way his diet is. So I'm not his physical therapist, so I don't talk to him about a lot of details around disc herniations or what they are and what they aren't and blah, blah, blah. But the reality is that you can actually heal many herniated discs, and that to have one does not make you special. I hate to say it, but it doesn't make you special to show up, to have an MRI that says, oh, you've got a flattened lumbar curve or flattened cervical curve, or you've got some kind of disc degeneration happening. Well, frankly, you're not special because of that. And this is sort of the tough love approach. But what's really, really important is not just the imaging, not just what the imaging says, although that can sometimes be helpful. But from a musculoskeletal point of view, I would really highly recommend that before requesting more imaging, seek out a skilled physical therapist who can work with you one-on-one. Let me say just a bit more about that. I know a lot of folks in chronic pain have tried physical therapy, haven't gotten very far. I think kind of like maybe like yoga to some extent. You might try 10 different teachers and then find the one that you really resonate with. But in terms of physical therapy, keep trying new physical therapists. If you haven't figured out one that works, give them a few sessions, 3 to 4 sessions minimum. And then if it really isn't a good fit, move on. But one of the signs of a good fit is that the clinic itself is structured in a way that they can work one-on-one with somebody for at least half an hour. Another sign is that they're empowering you as the patient to start to heal yourself, that they're not creating a dependent thing where you have to come in and I have to fix you and then you feel better for a few days and then you come back, that you have a set of really targeted exercises that can help you, that make a meaningful difference in your life. They may not make a difference that day, but they make a difference over the course of a few days or a week. Really, really, really important. Don't give up on the healers within the medical system would be what I'd say.
Oh, that's a great reminder and great advice. Okay, so we have the myofascial release that you talked about. The motion is lotion, so take a walk or bring some movement into your body and really find a good
my
fit
favorite
for your what?
I said my favorite motion is lotion is just dancing. And I'll tell you guys, like I work with my hands, I work with my shoulders, I've been teaching yoga, I've been doing physical therapy for a number of years, and so I use my body for work, and I get my aches and pains like anybody else. And when I start to feel sorry for myself, I put on, like I have a specific Pandora station that I put on, and I just like rock out, and I just dance in my house with nobody watching. So that's the kind of thing that you can do even if you're in a wheelchair. You can tap your toes, you can feel better, you can start to work on that neurobiological level, even if there's not a whole lot of motion that you feel comfortable doing, just any motion, blinking, smiling, shrugging your shoulders, start to get a little bit in, and it's so profound.
Yeah.
I'm sorry I interrupted your list.
No, that's okay. And it sounds like deep breathing, right? That can bring a lot of motion and flow of energy into your system. I mean, from a yoga perspective, right? That's like the breath is the prana.
Yeah, I mean, I don't know that it's precisely deep breathing that helps people, but diaphragmatic breathing for sure. So slow, steady breath. Using the muscle of your diaphragm is really powerful because I'm hesitating to say this, but it kind of massages your internal organs, which then helps with elimination. It helps with digestion. It can help, especially with people who get back pain, it can help with just getting everything moving in your torso. It's amazing. So diaphragmatic breathing, for sure.
Okay, great. So motion is lotion. Dancing, walking, diaphragmatic breathing. That's such a great reminder to, if you don't like your physical therapist or aren't having a connection or whatever, it doesn't make that a bad person doesn't make that physical therapist a bad therapist. It might just not be a good fit. So keep looking. And then for the myofascial release, you're going to provide our listeners with a little instructional video, which is so generous of you and how helpful.
Yeah. So
can you say a little bit about it?
I'd love to. I founded a website and a program called Yoga Anatomy Academy a couple of years ago, and I just love this little baby of mine. Yoga Anatomy Academy is really about serving yoga teachers to teach them more intelligent anatomy, which is not to say that they have to know the kind of anatomy that I know as a physical therapist, but they have to know the right kind of questions to ask so that they aren't paranoid as yoga teachers, that they're going to hurt somebody, and so that they really know how to empower, of course, themselves and students to stay healthy in yoga. So I have this website, yoganatomyacademy.com, and in that website, at that website, I'm going to give you guys a freebie. It's a 5-minute myofascial release, self-myofascial release freebie. It's just a quick video that I shot on my phone, and it's really powerful. Like I said, I had one patient do this for less than 30 seconds, and her pain went down from a 6 to a 1. So if you have never tried self-myofascial release or you never really knew what you're doing with it, come check this out. It's at yoganatomyacademy.com/heal-yourself. yoganatomyacademy.com/heal-yourself.
Awesome. Well, Arielle, thank you so much for sharing your stories and your wisdom and these super helpful techniques that hopefully will be a source of light that people will step into to empower themselves to heal. I really appreciate everything you shared. Thank you so much.
Thank you so much for all the advocacy you're doing for people who are in chronic pain. This is such a vital conversation to have, as we know with the opioid crisis and everything going on right now. There's simple solutions that are just ignored, and I am obviously a huge believer in those solutions. So thank you all for listening as well.
Thanks.